Dear Stefan, now next question to you. We usually speak about referrals to other professionals, and somehow it seems that the referrals to chaplains, psychologists, or therapists are quite like they're not happening as often as one wishes, maybe. What's the problem there?
Yeah, thank you. I totally agree. And I think it is simply because for clinicians, all these professions you just named are out of scope. So they do not know that they can rely on the help of a chaplain when treating a patient or discussing different issues with patients and relatives. And also for psychologists, it's sometimes very difficult to get to the patient if there is not a special referral from, the primarily treating physician. So I think in future we should really think, because as clinicians, as neurologists, we are not trained in all these specialities. So we really can, take the chaplain, take the psychologist, and take also other therapists to support our treatment for the patient and for the relative.
Yeah, we know from research regarding to education that if you have interprofessional training, then these referrals might happen more often. So do you think that it's a problem how physicians are trained separately, for example, from nurses, and how could we improve this situation?
Yeah, I think the physician primarily thinks, and this way they are trained, that they have to do everything by themselves, and they only in very special situations can rely on these other professions. And I think, as you already mentioned, we really have to bring this into the education, that we have our professions and there are other professions which really help us treat the patient and the relative, or especially in difficult issues, we can rely on these other professions. However, there must be one strain, bringing all these issues together, and this is still the physician.
Yeah, we, for example, in Central Europe, where the nurses' profession is still very much seen as a vocational, we also hear from nurses that they are afraid to comment on the patient's situation or to confront the physician. It doesn't even have to be a fight or conflict, but maybe nurses have heard more. How you have solved this situation in your team so that, nurses also can speak?
Yeah, actually, what we do is we having our daily visitation of the patient together with the nurses and even with other professions. So we have, when we go to the patient, we can, beforehand or after we have seen the patient, a discussion within the team, within the nurses. So what did they see? What has happened during the night? What kind of discussion did they have with the patient? And so we bring these different viewpoints together, and this is very important. So we have to learn to work together.
Thank you very much.